Coagulation cascade. Overview of hemostasis. Coagulation is a process which leads to hemostasis. Hemostasis is the cessation of blood loss from damaged blood vessels. Series of overlapping reactions. Vasoconstriction, platelet plug formation, coagulation, fibrinolysis. Vasoconstriction, platelets come in contact with damaged blood. Their surface becomes sticky and adhere to the damaged wall. They then release serotonin, blood vessel constricts, reduced blood flow. Other vasoconstrictors such as thromboxas also released. Platelet plug formation. Adherent platelets clump to each other and release other substances such as ADP, which attracts more platelets to the site. Passing platelets also stick. Positive feedback system forming a temporary seal called the platelet plug, formed within 6 minutes of injury. Coagulation, complex process also with a positive feedback system. Coagulation factors activated by the platelets, leading to generation of a fibrin clot that reinforces the platelet aggregate. Fibrinolysis. After the formation of the clot, the process of removing it and healing the blood vessel begins. Fibrinolysis is the first stage. Plasminoid trapped in the clot is converted to plasmin via activators released from damaged endothelium cells. Plasmin breaks down fibrin to soluble products that are treated as waste material and removed via phagocytosis. Clot is removed and healing process restores the integrity of the blood vessel wall. Coagulation cascade. Blood coagulation means the conversion of liquid blood to gel or clot. Main event is conversion by thrombin of soluble fibrinogen to insoluble fibrin. The components, called factors, are present in blood as inactive precursors, zymogs, of proteolytic enzymes and cofactors. Activated by proteolysis, the active forms being designated by the suffix -a. Factors 12A, 11A, 10A, 9A and thrombin, 2A, are all seriproteases. Two types of pathways. Intrinsic, contact, pathway. Intrinsic has all components present in blood. When blood comes in contact with artificial substance such as glass. Extrinsic, in vivo, pathway. Extrinsic has some substances present outside the blood. Clotting factors. Factor 1, fibrinogen. Factor 2, prothrombi. Factor 3, thromboplastin. Factor 4, calcium. Factor 5, proaccelery. Factor 7, proconverti. Factor 8, antihemophilic factor A. Factor 9, Christmas factor. Factor 10, Stewart-Prower factor. Factor 11, antihemophilic factor C. Factor 12, HEMA factor. Factor 13, fibrostabilizing factor. Factor 14, precalicry. Factor 15, high molecular weight COAG. Factor 16, von Willebrand factor. Factor 17, 8-thrombi 3. Factor 18, heparicofactor 3. Factor 19, protein C. Factor 20, protein S. Overall pathway. Thromboplastin initiates the extrinsic pathway. Endothelial collage initiates the intrinsic pathway. Both intrinsic and extrinsic pathway initiate the common pathway, where factor 10A converts prothrombi to thrombin. Thrombin converts fibrinogen to loose fibrin clot, which is converted to stabilized fibrin clot. Thank you for watching.